Good Friday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to our environmental health team. These folks have been extremely busy since the pandemic began, providing critical guidance and education for businesses in our community. They've worked closely with businesses who have identified COVID positive staff members in order to reduce the rate of transmission. We are incredibly thankful for the work they are doing and will continue to do. On Monday, we will continue to test folks at KCHD from 8 a.m. to 12 p.m. Next Wednesday, however, and Wednesday and Friday, we'll be testing at the Jacobs Building in Chilhowee Park from 9 a.m. to 3 p.m. Moving forward, this will be our main location for COVID-19 testing. However, there may be a few days that we're not able to test there. We'll be able to get that information out to you as soon as we can. We're grateful for this partnership with the city that allows us to extend our hours and increase safety for those waiting in line due to the heat. Now we'll move to the local situation. We have 3,761 confirmed cases of COVID-19 in Knox County. Additionally, we have 123 probable cases. 1,643 of our cases have recovered, giving us 2,085 active cases. 194 individuals have been hospitalized at some point in their illness. Currently, there are 40 Knox County residents hospitalized, and we are saddened today to report 2 additional deaths related to COVID-19, bringing our total to 33. Our thoughts and prayers continue to be with the loved ones and friends of those who passed away. As a reminder, the next Board of Health meeting is Wednesday, August 5th at 5 p.m. The public can view the meeting meeting live on Knox County's YouTube channel or the Knox County website. Now I'd like to spend a few minutes discussing the topic of false negatives and false positives. First of all, it's important to remember that no test is 100% accurate, so all tests, COVID or not, have false positives and false negatives. But today, I just really want to talk specifically about COVID-19 testing. So false positive in general means that the test came back positive, but the person actually doesn't have the disease or doesn't have COVID-19. A false negative means someone's test came back negative, but they actually do have the disease or they have COVID-19. From a public health perspective, false negatives are actually more of a concern because that means someone could be returning to life as normal, gathering with their family and friends and going to work when they actually are positive for COVID-19. That could lead to further transmission of this virus as they could spread it without even knowing they are positive or actually thinking they're negative. At KCHD, we use the PCR test, which is either a nasal swab and oral swab. The PCR test is currently considered the closest to gold standard for COVID-19 testing. That means it's thought to be the most reliable because it looks for actual presence of the virus DNA and RNA in your system. So those virus particles. The PCR test, which is utilized across the country and the world, according to the currently available data, the sensitivity ranges from 79 to 90%. Sensitivity is the proportion of patients that actually have COVID that test positive, or the true positive rate. So that's around 70 to 90% with the PCR. The COVID-19 PCR test is thought to have about a 95% specificity rate. The specificity rate is the portion of people without COVID who have a negative test, so the true negative. So those are people without disease. There are many factors that can contribute to false negatives and false positives, everything from specimen collection to how many viral particles need to be present for the test to be positive. In speaking with a local infectious disease doctor, they are seeing about 3 to 4 false positives for about every 1,000 true positives. That's a pretty good ratio. It's also important to know a little bit about how the virus manifests in the body. It appears that the virus is not detectable immediately after infection. So if someone were to get tested the day after their exposure, the probability of their test coming back positive is very slim, even if they are going to go on to develop the disease. So if somebody waits a few days after they've been exposed to get a COVID-19 test, it's more likely to be positive if they're going to develop COVID-19. So don't run out as soon as you learn you've been exposed to get a test. It's going to give you a false sense of security because there has to be enough virus in the body for the test to pick it up. On Wednesday, Charity mentioned that there have been a very low number of KCHD tests that have returned a positive and a negative test on the same person. For those tests, it would not be accurate to refer to them as false positives because it is not known which of the two tests is correct. Therefore, you can't assume the positive is the wrong one. That being said, erring on the side of caution, that individual from the public health perspective is counted as a positive and told to isolate. This is based on guidelines set by the Tennessee Department of Health. If that person was instead counted as a negative, we could be running the risk of having someone return to life as normal when indeed they are positive. Once again, this applies to a very low number of our cases. We don't want the implication to be that false positives are ballooning our case numbers because that's not the case. As we have said, there is thought to be a much higher false negative rate. That means there are more people in our community who have the virus, but the test doesn't show that. This is much more of a public health concern because we don't want those people unknowingly spreading the disease. And so that's why we continue to stress the importance of the 5 core actions. Regardless of whether you have a positive or negative test, remember the test is not prevention. The 5 core actions are prevention and will protect you. And having a negative test multiple times doesn't protect you from the virus. You can still become positive anytime after that. If you're getting a PCR test with a swab in your nose or your throat, we ask that you just wait until those results come back. There's no need to get another test because it might come back faster. We are aware of people getting multiple tests because they want to get the result back faster, or they want to be released from quarantine, or they're just scared. As a reminder, you can't test your way out of quarantine. We do not encourage people to get tested more than once, as it is not a good use of resources. Once again, testing is not prevention. And now I'll open it up for questions.
All right, any other questions? Please go ahead and submit them into the chat feature now. Let's see, the first question we have is from Grace with WBIR. Can you recap how the local COVID-19 situation has changed in July?
I'm not sure what you mean by recap. Our cases have increased quite a bit. Our deaths have gone up. So we have more cases, we have more people hospitalized, we have more people who've passed away from COVID-19. If you want specifics, we can get you those specifics.
Yeah, if you have any more specific question there, Grace, we'd be happy to answer it. Madison with WATE asks, can you provide the specific studies or data that Knox County is using to measure the effectiveness of mask usage to curb COVID?
Well, there's a Lancet study. There's several studies that are publicly available that you can find. We can certainly send you those. And then, locally, what we'll be looking at is transmission rates, to be honest. Seeing those transmission rates go down, seeing fewer cases because people are wearing masks will tell us that mask wearing is effective.
From Madison with WATE, yesterday we got word about contact sports on hold in Knox County. Where do those conversations stand now regarding contact sports for the fall from the health department's perspective?
Those are internal conversations that'll be held by the schools. They certainly can consult with us if they like, and we do talk with them regularly. We met with them yesterday about school in general, not about contact sports. So I'm sure they'll reach back out to us regarding contact sports when they have a question.
From Megan with WVLT, during the last Board of Health meeting, data showing that mask mandate is beginning to work was discussed. Can you break down what that data showed in layman's terms? Okay, I'm not familiar that we presented any data. Dr. Shmia. Okay, that was Dr. Shmia's presentation. I apologize. Yeah, not our data, but I'll do my best. So what Dr. Shmia demonstrated with his projections and looking at numbers, it appears that our COVID-19 case rate is starting to slow down. So it's not going away,
but it's slowing down. So we're not climbing the hill at quite such a pace. It's slowing down a little bit, hopefully starting to see that come down further over the next few weeks. So basically, the slowdown in our case rate is what they're seeing in their data.
From Vincent with the Sentinel, can you explain the role of the precautionary principle in public health decision-making?
I'm not familiar. I apologize. I can certainly read about the precautionary principle, but I'm not familiar with it.
From Grace with WBIR, can you explain what a transmission rate is?
The transmission rate is for every person who has a disease, COVID-19 or the flu, how many other people are they going to make sick?
From Grace with WBIR, while Knox County has mandated masks and closed bars, neither our surrounding counties nor the state have made similar moves, with the exception of severe mask requirements. Do they affect Knox County, and what's your message to them?
Of course it affects Knox County. The virus nor people respect boundaries of counties. So we go back and forth a lot. So I think it would be helpful if we had across the board similar policies in limiting the spread of disease. But those are decisions made by local entities and by the state government. And they certainly are using the data they have and the information they have to make those decisions, and I respect their decisions.
From Claire with WUOT, what are the parameters for how you can spend the $7.1 million in new funding you've received? Are there restrictions for what you can spend this money on and what you can't?
We can get that information to you, Claire. There are some restrictions, and I've read the contract, but don't have it set to memory. So we can certainly get those restrictions to you.
From Vincent with the Sentinel, the Knox County Health Department has to weigh different kinds of scientific evidence. Is it appropriate in a public health emergency to wait for highly specific studies, or should public health authorities act on the evidence that is available to them?
Well, I believe we're doing that. I believe we're acting on the evidence that's in front of us. We're using our benchmarks and our local data to provide guidance for the Board of Health, provide guidance for our community and leaders to make decisions. We do that all the time, to make decisions based on the information in front of us. We also learn from other communities. We see other communities put things in place and they see their case rates go down. So what can we learn from that community? So it's active learning in the public health arena right now.
From Grace with WBIR, we've had 11 deaths in the last week. Is there any explanation for that?
We don't have an explanation. We don't speak specifically about anything related to cases, but I'm not aware of any explanation for that.
She also asks if you have the age and gender information for the 2 deaths reported today.
Sure. One was a 64-year-old male and one was a 67-year-old male.
Also from Grace with WBIR, as the group conducting contact tracing of the outbreak in our community, how do you expect the Board of Health's order to close bars will impact COVID spread?
Well, what we hope to see is that it reduces COVID spread, because we know what we know about COVID-19 is that staying away from each other reduces the risk that we get it. Actually can eliminate the risk that we get it. Wearing a mask reduces risk. Washing your hands reduces risk. Cleaning surfaces reduces risk. Staying home if you're sick reduces risk. Closing bars is a way to keep people away from each other. So we all know we go to bars to gather, mingle, and have a good time with our friends. So the Board of Health had concerns that people gathering at bars was a potential risk point for our community. So in reducing the risk for our community, closing bars was chosen as one step to do that. It's not instead of the 5 core actions. We still all have to do the 5 core actions, and we can't just go, we're done, close bars, that's going to fix the problem. All of us have to keep doing all of these things in order to reduce risk and reduce case rates in our community.
From Megan with WBLT, can you speak to the availability of medical staff in Knox County? What types of medical workers are in highest demand, and is there a nurse shortage?
That's a great question for the medical providers. We currently are fully staffed here at the Knox County Health Department, and I can speak to our staffing.
From Claire with WUOT, what is your opinion about Governor Bill Lee's ongoing decisions not to follow federal guidance from Dr. Deborah Birx and the White House Coronavirus Task Force?
Governor Lee is using the information available to him to make those decisions, and I respect his decisions.
From Vincent with the Sentinel, he says the precautionary principle is a way of approaching a risky situation where information is not 100% certain that emphasizes avoiding unnecessary risk. Can you comment on this framework in a public health context?
You know, we in public health are constantly, or at least in parts of public health, constantly looking at reducing risk. And reducing risk in everything from motor vehicle accidents to putting your baby to sleep in a safe way to infectious diseases. So we're always using the data available to us to reduce risk. And we almost always try to err on the side of caution to make the safest choice for our community based on the data that we have and based on the information we have. And that's how we make decisions here at the health department, how public health makes decisions across the country.
From Grace with WBIR, can you explain how you count recoveries, and do you have confidence in those numbers?
We do have confidence in those numbers. Recoveries are people who are a case, who have finished their isolation period, or a probable case who's also finished their isolation period. So those are those two categories. So a case who's finished their isolation period, or a probable case who's finished their isolation period. And we feel comfortable with those numbers because we're talking to those people each day, or the Tennessee Department of Health actually now is talking to those people each day. And public health is determining when that person can be released from isolation. So I feel very comfortable with those numbers.
From Megan with WVLT, the SEC announced they intend to continue holding 10 games this season. Do you believe limiting games to in-conference only will be enough to help stop the spread?
Well, what we know about when the CDC talks about risk stratification, there are activities that are lowest risk, a little higher risk. So limiting teams, the different numbers of teams coming from different places, is one way to limit risk. So limiting the exposures limits risk. So if you look at that, you can look at that on the CDC's guidance for sports. It's for recreational sports, but it applies to all sports.
From Grace with WBIR, she has a follow-up question. Is that isolation period 10 days or the 21 days TDH uses for recoveries?
I'm not familiar with the 21 days TDH is using for recoveries. I apologize. So the CDC guidance and the TDH guidance for a case of COVID, and we are also treating probable cases this way, is that you have to be in isolation for at least 10 days, plus also being symptom-free for at least 24 hours. So sometimes somebody might be in isolation for 10 days, but still feeling sick on day 10. So they have to go another day. So it has to be at least 10 days plus a full 24 hours. I think there is some confusion for the guidance that's put out there for medical providers. So a severely ill medical provider, so somebody who gets really sick, has a 20 or 21 day period of isolation. Everybody else is a 10-day isolation with that, plus that 24 hours of symptom-free without using medication to treat your symptoms.
From Vincent with the Sentinel, in the discussion that the board had regarding the bar closure order, there appeared to be some tension between requiring specific evidence about bars and members of the board who are emphasizing the risk bars pose to the public in the context of how COVID-19 is known to spread. Can you comment on this conversation and the way these kinds of evidence are weighed?
So when we look at the situation we're in, certainly people have opinions, and people look at different evidence and data and research about when we're making these really challenging decisions. I think the tension really speaks to how difficult this decision was to make. The board wants to make sure they're making the best decision for the community. And so they're weighing all the different pieces of information and data that we have. So there's local data and there's national data. National data has shown some places when they closed bars have seen their case rates go down. Arizona is one case. I know that Nashville and Shelby County, Davidson County and Shelby County are actually trending down. They've closed their bars. Is that a contributing factor? We'll kind of have to wait and see. So the board weighed all of that. They weighed local information, they weighed national and state information in making that decision. But the tension really, I think, speaks to how seriously the Board of Health takes this and how seriously they take these decisions and how heavy these decisions are for them to make.
From Grace with WBIR, it's another follow-up. Are your contact tracers following up with everyone after 10 days to check on them, or how does that work?
Okay, so contact tracers are tracing contacts. So contacts are in quarantine for 14 days. What happens during that 14 days is they get a phone call every day. Say, how you feeling? Do you feel sick? Do you have any symptoms of COVID? And are you staying home? So they're checked on every day during that 14-day quarantine period. So the 10 days of isolation refers to a case. So a case is a person who is either a probable case, they don't have a lab yet, but they're a contact to a case and they have symptoms. Or a case is also confirmed by a lab, and that's an actual case. So those people are called every day also to see if they're staying in isolation, see if they need anything, see how they're feeling. And once they've completed their 10 days of isolation, plus that 24 hours, then that's a case monitor, then releases them. Contact monitors, case monitors, and contact tracers. The monitors monitor people while they're in isolation quarantine. The tracers find people.
From Vincent with the Sentinel, can you comment on the risk of requiring specific kinds of evidence before taking action poses rather than taking action with the evidence that is available?
Well, if you wait for exactly the data that you need to inform all of your decisions, you could wait too long, and as a result, end up having more cases than you might have had if you made a decision earlier. So delaying those decisions to have actually all of that perfect information right there can cause, it can increase risk for the community and increase cases. So sometimes we have to make a decision, again, based on local information and other information and learning, again, actively as we go and learning from other communities.
Any other questions? Please go ahead and submit them now. From Alan with Inside of Knoxville, it sounds to me as if cases have 10 days quarantine and contacts have 14. Am I misunderstanding?
Okay, so cases have 10 days plus 24 hours without symptoms of isolation. The case is in isolation. So cases have 10 days plus 24 hours without symptoms in isolation. A contact has 14 days of quarantine unless they become symptomatic and then they flip over to being a case. So contacts, 14 days of quarantine, case, 10 days plus 24 hours without symptoms of isolation.
The next question is, if a contact does develop symptoms, it seems likely they would test positive. Are they tested?
They have the option of being tested. But that's why we have our probable case definition to categorize those folks who are a known contact, who develop symptoms, who choose not to get tested, or maybe don't have access, they just make a choice not to get tested. We call them a probable case. We treat them as a case. They have to stay in isolation. So they have to stay in isolation from onset of symptoms for at least 10 days, and when their symptoms are getting better, for at least 24 hours.
Next question is, why does a contact have a longer period than a case?
Because it's based on the incubation period of the disease. Incubation period for COVID-19 is 2 to 14 days. So we want people to go out to that 14th day to make sure they don't become symptomatic. That's why we say you can't test yourself out of quarantine, because say you get tested on day 7, you could still you still got 7 days before you might develop COVID. So we don't want you to get out of quarantine. Isolation is based on transmission, and infectivity. So from onset of illness, what we see is if we give somebody 10 days plus they're feeling better for at least 24 hours, we know they're not going to make other people sick. So if somebody without symptoms, we really base it on the testing day and 10 days after the testing day. So that's based on transmission, not on incubation period.
From Megan with WBLT, for anyone who might be wondering if they should get tested, who should be seeking a test and when?
Any contact to a known case of COVID-19 should consider getting tested. Anybody with symptoms of COVID-19, the symptom list has gotten bigger. The primary cough, fever, body aches, malaise, fatigue, loss of taste and smell. Some folks have vomiting and diarrhea. So anybody with those symptoms should consider getting tested. And certainly anybody who is concerned they might have COVID-19 can certainly get tested. But we prefer to limit it to those folks who have some exposures and maybe have some symptoms.
From Vincent with the Sentinel, with respect to this precautionary framework, COVID-19's long-term health implications are still unknown. Can you comment on this with respect to preventing cases?
So absolutely, you're correct. COVID-19's long-term health effects are unknown, although we are seeing some some early studies that indicate some effects on athletes around their heart function that are coming out early. So the sooner we know those things, the better we can advise cases. And certainly folks who get COVID-19, the other thing that we know, who become severely ill and maybe spend a long time in the ICU, those folks have long-term health effects, well documented that after a long stay in the ICU, folks have some challenges when they get better from that. You know, in the context of public health, you know, certainly we'll have to wait and see what the long-term effects of COVID are. I think what I would say is the long-term health effects of COVID might not be related to the disease itself, but they might be related to the things that have happened during the disease. Economic turndown, people maybe not seeking care because they were concerned about going to the doctor. So that making those chronic conditions that are always with us worse because of the situation created by the pandemic of, you know, affecting the economy, affecting people seeking care. Those are the kind of some of the concerning things that we think about in public health.
All right, any other questions? All right, see, Grace says she has one more. I guess she's currently typing. And this will most likely be our last one as we're getting close to 1 o'clock.
It's a long one.
From Grace from WBIR, she says, you mentioned probables can be recovered. Are those counted on your website?
Yes.
All right, not seeing any other questions. So thank you all for joining us, and we will be back with you on Monday. Have a good rest of your day and a good safe weekend.